As people age, they may develop various unpleasant behaviors that are often overlooked or rarely discussed. These changes can range from increased negativity and aggression to cognitive decline and physical health issues, presenting challenges for both seniors and their families. As seniors age, they may exhibit a range of behavioral changes that can be challenging for both themselves and their families. One common issue is increased negativity and complaining, which may stem from various factors such as chronic pain, loneliness, or frustration with declining abilities. This negativity can manifest as constant criticism, pessimism about the future, or frequent arguments over minor issues. Aggression is another behavioral change that some seniors may display. This can include verbal outbursts, physical aggression, or resistance to care. Such aggressive behavior might be triggered by confusion, fear, or as a response to perceived threats, especially in seniors with cognitive impairments. Paranoia and suspicion can also become more prevalent in older adults. Seniors may accuse family members or caregivers of theft, mistreatment, or conspiracy against them. These false accusations can strain relationships and make caregiving more challenging. Some elderly individuals may develop an increased need for attention, constantly seeking reassurance or company from their family. This behavior can be exhausting for family members and may stem from feelings of insecurity or fear of abandonment. Another behavioral change is the tendency to engage in risky or inappropriate behaviors. This might include overspending, gambling, or making poor financial decisions. In some cases, seniors may exhibit a lack of social inhibition, leading to inappropriate comments or actions in public settings. It's important to note that many of these behavioral changes can be symptoms of underlying health issues or side effects of medications. For instance, urinary tract infections can cause sudden confusion and agitation in seniors. Therefore, any significant behavioral changes should be evaluated by a healthcare professional to rule out medical causes and determine appropriate interventions. Understanding these potential behavioral changes can help family members approach their aging loved ones with empathy and patience. It's crucial to remember that these behaviors are often not intentional, but rather a result of the complex physical and emotional challenges that come with aging. Cognitive and emotional decline in seniors can manifest in various ways, often leading to behaviors that may be challenging for both the elderly individuals and their families. One of the most common issues is memory loss, which can range from mild forgetfulness to severe impairment associated with conditions like dementia. Seniors may struggle to recall recent events, names, or important dates, leading to frustration and anxiety. As cognitive abilities decline, some elderly individuals may experience difficulty with decision-making and problem-solving. This can result in poor judgment, especially in financial matters, making them more susceptible to scams or unwise spending habits. In some cases, seniors might become overly frugal or, conversely, engage in excessive spending, causing concern for their families. Emotional changes are also prevalent among aging adults. Many seniors experience mood swings, which can be exacerbated by hormonal changes, medication side effects, or chronic health conditions. These mood fluctuations may lead to sudden outbursts of anger or periods of withdrawal and isolation. Depression is a significant concern in the elderly population, affecting approximately 7% of older adults. It can manifest as persistent sadness, loss of interest in previously enjoyed activities, or a general sense of hopelessness. Depressive symptoms may be mistaken for normal aging processes, leading to underdiagnosis and inadequate treatment. Anxiety disorders are also common among seniors, often triggered by health concerns, financial worries, or fear of losing independence. This anxiety can manifest as excessive worry, restlessness, or even physical symptoms like rapid heartbeat or shortness of breath. Some elderly individuals may develop paranoid thoughts or delusions, particularly those with cognitive impairments like dementia. They might become suspicious of family members, accusing them of theft or harboring ill intentions. These false beliefs can strain relationships and make caregiving more challenging. It's crucial to note that cognitive and emotional changes in seniors are not always an inevitable part of aging. Many of these symptoms can be indicators of underlying health issues or side effects of medications. Regular medical checkups and mental health screenings are essential for early detection and management of these conditions. Caregivers and family members should approach these changes with patience and empathy, recognizing that the behaviors are often beyond the senior's control. Seeking professional help from geriatric specialists or mental health professionals can provide valuable strategies for managing cognitive and emotional decline, improving the quality of life for both seniors and their families. As seniors age, they often face a range of physical and health challenges that can significantly impact their daily lives and contribute to some of the unpleasant behaviors previously discussed. One of the most common issues is mobility and balance problems, which can lead to an increased risk of falls and a decreased ability to perform everyday tasks independently. This loss of physical autonomy can be frustrating and may contribute to negative attitudes or increased dependence on family members. Chronic health conditions become more prevalent in older adults, with heart disease being a leading concern. The management of these conditions often requires multiple medications, which can lead to side effects and interactions that may affect behavior and cognition. Obesity is another significant health issue among seniors, potentially exacerbating mobility problems and increasing the risk of other health complications. Urinary incontinence is a common but often under-discussed problem that affects many older adults. This condition can be embarrassing and may lead to social isolation or reluctance to participate in activities, contributing to mood changes and negative behaviors. Additionally, the frequent need to use the bathroom can disrupt sleep patterns, leading to fatigue and irritability. Sensory impairments, such as hearing and vision loss, can significantly impact a senior's quality of life. These changes can lead to communication difficulties, increased social isolation, and a higher risk of accidents or injuries. The frustration of not being able to hear or see clearly may manifest as irritability or withdrawal from social interactions. Osteoporosis is another health concern that disproportionately affects older adults, particularly women. This condition weakens bones, making them more susceptible to fractures. The fear of falling and potential injury can lead to decreased physical activity, which in turn can accelerate muscle weakness and further mobility issues. Sleep disturbances are common among seniors and can have a significant impact on their overall health and behavior. Many older adults experience changes in their sleep patterns, including difficulty falling asleep, frequent waking during the night, and early morning awakening. Chronic sleep deprivation can lead to daytime fatigue, irritability, and cognitive impairment, potentially exacerbating other behavioral issues. It's important to note that many of these physical and health challenges can be managed or improved with proper medical care, lifestyle modifications, and support systems. Regular checkups, appropriate medication management, and engagement in physical activities tailored to the individual's abilities can help mitigate some of these issues. By addressing these underlying health concerns, it may be possible to alleviate some of the unpleasant behaviors associated with aging, improving quality of life for seniors and easing the challenges faced by their families. Many of the unpleasant behaviors exhibited by seniors can be attributed to underlying health conditions that are often overlooked or misdiagnosed. Urinary tract infections, UTIs, for instance, are a common but frequently unrecognized cause of sudden behavioral changes in older adults. UTIs can lead to confusion, agitation, and even hallucinations, particularly in seniors with existing cognitive impairments. Chronic pain is another significant factor that can contribute to negative behaviors in the elderly. Persistent discomfort from conditions such as arthritis, neuropathy, or back problems can lead to irritability, decreased mobility, and a reluctance to engage in social activities. The impact of chronic pain on mood and behavior is often underestimated, yet it can significantly affect a senior's quality of life and interactions with others. Nutritional deficiencies can also play a role in behavioral changes. As seniors age, their ability to absorb certain nutrients may decrease, leading to deficiencies that can affect cognitive function and mood. For example, vitamin B12 deficiency, which is more common in older adults, can cause symptoms such as confusion, memory problems, and depression. Medication, side effects, and interactions are another crucial consideration when evaluating behavioral changes in seniors. Many older adults take multiple medications, increasing the risk of adverse reactions and drug interactions. These can manifest as confusion, dizziness, or changes in mood and behavior. It's essential to regularly review and adjust medication regimens to minimize these effects. Undiagnosed or poorly managed diabetes can lead to fluctuations in blood sugar levels, which may cause irritability, confusion, and in severe cases, delirium. Similarly, thyroid disorders, which are more prevalent in older adults, can significantly impact mood and energy levels, potentially contributing to depression or anxiety-like symptoms. Sleep disorders, such as sleep apnea, are often underdiagnosed in the elderly population. These conditions can lead to poor sleep quality, resulting in daytime fatigue, irritability, and cognitive impairment. Addressing sleep issues can have a profound impact on a senior's overall behavior and well-being. Lastly, it's crucial to consider the possibility of early-stage dementia or mild cognitive impairment when evaluating behavioral changes in seniors. While not all cognitive decline is pathological, subtle changes in memory, judgment, or personality could be early indicators of more serious conditions that require medical attention. Understanding these underlying health causes is essential for families and healthcare providers. By identifying and addressing these issues, many of the unpleasant behaviors associated with aging can be mitigated or resolved, leading to improved quality of life for seniors and reduced stress for their loved ones.